Deep in the Ottawa Valley, members of the Algonquins of Pikwakanagan First Nation are sounding the alarm. Officials recently declared a state of emergency. Drug overdoses are ravaging the community.
We're losing too many of our people to death, and the people who end up in having an overdose are that much closer to not surviving.
Drug-related deaths have surged across the country since the pandemic, and the First Nation is no exception. Before 2020, it saw an average of 5 drug-related deaths a year. In the first 6 months of 2023, there were 12, a staggering loss in a community of just 500 people.
And when someone hurts, we hurt.
Michael Dustin Commando is a member of the First Nation and works there. He knows the impact of this crisis firsthand.
But I do have family that has drug addictions, and I see no change of them getting better.
So there's 5 steps to respond to the opioid overdose.
The small team at the local health center says they see roughly 3 overdoses a week, and with not enough resources, they're being pushed to the brink.
Trying to get services out to people, trying to get out safe supplies, trying to educate.
Declaring a state of emergency gives the First Nation access to government funding for addictions treatment and programming, partnerships with provincial and federal agencies to help form an action plan, and more police officers stationed in the community to help stem the flow and sale of drugs in and around the First Nation.
Pikwakanagan is not isolated. We don't have closed borders. We're quite open.
The chief of Pikwakanagan says this state of emergency will remain in place as long as is necessary until council feels like the situation is under control and community members are safe. Nicole Williams, CBC News, Pikwakanagan First Nation, Ontario.